Hi, everyone. As Jen said, it's very exciting to see everyone join today. We expect a big crowd and really hope so today. It's very, very exciting moment, but just a moment in the overall process that probably gets harder from here, but is more meaningful and more real to everyone. So, hi, everyone. I'm Tom Donaldson with NOFAS. This is the NOFAS National Organization on Fetal Alcohol Syndrome monthly policy and training forum. Please mute if you're not speaking. There will be an opportunity as we go through today's presentation for questions and comments, but please remain muted during today's presentation. And we will start by hearing from the NOFAS affiliate director, Susan Ellsworth, with a brief update.
Hi, everybody. It is so exciting to see everybody join. I'm happy to be with you, and thank you for joining today for our policy update and how things are going with you. I wanted just to briefly touch base about some of the really great things that are going on in the affiliate network. We are putting together our affiliate summit, which is going to be taking place in September this year. It will be another
Susan, you're muted.
Thank you, Jen.
You're welcome.
So do I start all the way back over at the beginning and fill in what my lips were saying?
You were at the affiliate summit.
Thank you.
You're welcome.
Our affiliate summit is going to be September the 27th through the 29th. And we're going to be hosting some really great speakers with some fabulous topics. We also are talking to several of you who are working with Jen on getting this legislation passed in your groups around the country, and talking about the opportunity that you would have to join the NOFAS affiliate network. Some of the benefits that we have of being part of a network together are being able to unite our voices and making a louder voice. We also have opportunities to learn from each other, because as we're embarking on getting this legislation going and passed, we have affiliates that have tremendous skill sets in certain areas that have walked in front of us and can share their expertise as we go. And just being part of having a consistent message for mainstream, looking at the FASD experts, and they're looking to hear our language being consistent across the country, and with a focus toward balancing our message that goes out, that shares some of the challenges of FASD, as well as the successes for the individuals who have been affected by FASD in a non-stigmatizing way. So if you have any questions, you have some interest in hearing more about what it would be like to be a NOFAS affiliate, please reach out to me. I'd be happy to set some time aside for us to chat. And now I'm going to turn it over to Susan Carlson to start us off.
Okay. Hi, everybody. Exciting times. It's good to see you all. Waiting for Jen to start her screen sharing. Boy, it seems like it's been a long time coming, but we have bill numbers. And if you've been on social media, you've gotten some updates there. But first, I think for those that haven't been on before, I think we need a little bit of, and we'll do this in every policy, as to what we're doing and why we're doing it. And so the FASD Respect Act, actually the name was coined earlier this year by Jen. And but we are creating that foundation for a national FASD agenda. And so as you were able to look through a copy of the bill that got put online, you'll see there are many, many different programs, but it is the basic foundation, because we really haven't had that. And it's hard to start looking at other systems across, the various, different systems, schools, juvenile justice, and make changes until we do our foundation. And that's where FASD is understood and those that are impacted are supported. Prevention's accepted, supported, and widely understood by our community. So that's why you see the house, that's why you see the foundation. And then this will be the beginning. Once we get the FASD Respect Act passed, that we will start building up that house. Jen? So you all saw the bill online, and it's a much better bill than what was introduced last Congress, I believe. But these are the basics. And as we go on through this process, we will maybe do some different areas of the bill and show how it could impact individuals and families. But we just wanted to give a kind of a little bit of a summary as to what the bill is actually going to do. And and we actually, if you went through and looked at the bill, you saw that there were appropriations amounts attached to the sections, which was not in the last bill. And a bulk of the appropriations is going to the states, and a certain amount is going to the states for every state that applies for administration and to hire an FASD coordinator, because that is really the missing link in making sure that states begin to understand and recognize FASD in the whole prenatal substance abuse area. And so you will have seen, and I think that's probably the most important section, to have what we call systemic change. And part of that, and I know a lot of you have already jumped the gun and you want to start with your task forces, and I think that's very well. And now you have the language so you can see what the bill is going to require, at least at this stage. Now, as we go through the process, and we'll talk a bit more about the process, certain language can change, but I think the elements of the bill are good, and I think the appropriation amounts are, I think, enough to do what we want to do to get started in looking at FASD in their systems of care. And then the best practices and community partnerships was in the prior bill, and then we put the appropriations amount. So that'll allow various groups to apply for funding to develop best practice and those community partnerships. And I think this bill really zeroed in and focused on making sure that resources are going to be FASD informed, and that includes for families and children and adults. That was very intentional in this bill. And there's resources for training professionals in many systems of care. Wherever we could think of a system of care, we put it in. I don't think we missed any, but particularly education, justice, medical, substance abuse, child welfare, etc. The linchpin is the Center for Excellence, because if you don't have a Center for Excellence to deal with,
how are you?
if we could just turn mute our mics, that would be great. The Center for Excellence will help deal with the issue of diagnostic capacity, because as we've met around the country, and we've done a lot of meetings around the country with staff and advocates, this is a real barrier. And so you have a Center for Excellence that'll be dealing with that issue and helping states deal with that barrier. And then replicating best practices. And there's a lot of best practices out there, but this provides technical assistance and funding to be able for states and other communities to replicate those. And there's also money for prevention and training, et cetera, et cetera. And then the policy end of it is the National FASD Agenda, and it creates an advisory group made up of federal and non-federal members, 23 members, that will develop a national agenda, look at the previous National Task Force report, make recommendations to Congress on what's needed on that national agenda. So that's just a brief summary of the bill, and I hope that you'll all have had a chance to read it. There is this, we've done the section by section summary to help with that. Okay, Jen, next slide. So where are we? Okay, so the bills, we talked about this, and you've seen this beautiful slide that Jen has done. We are at bill introduction, and if you go to congress.gov, you'll officially see the two bills and their numbers, and the language of the bills are not on congress.gov. It takes a little while for that to happen. We're going to try a process that would have allowed that to happen right away, but it was through Murkowski's office, but it would have cost over $1,000. So we had copies of the bills from both authors, the House and Senate, as the bills were introduced. So you will see those on the our policy website. All the information you need is on the policy website. But to keep track of what's going on with the bills, you can click on the links that are in the website and get all the information you need. So this is how a bill becomes a law. I think we need to get back to the basics. Okay, so it's introduced, and now the next step is to be heard in the committees, House and Senate, and we'll talk a little more about that. And sometimes things don't follow exactly these steps. It could be heard in one house, in one committee, and then it comes the next, it would be just heard on the floor of the House or the other body. So, but I think what is important for advocates to understand is that we need to do till then. Now, we say September for the bill to be heard in committee, and that's because we've had some discussions, or I've heard discussions about Senator Murray, who's chair of the HELP committee, having hearings on substance abuse issues in September and October. So that will be our goal. And between now and then, the goal is to get as many authors as we can get. I talked to Patrick Malott, who's the Health LA from Representative McCollum's office. He's doing a Dear Colleague letter that's going to go out to all representatives asking for their support. And we're also going to be talking about doing staff briefings coming up. We're in the, trying to figure out schedule for that, when the best time is, and that would be bringing the staff together and bringing our experts and individuals with FASD and families to tell the story to staff members on why their members should support this. And then obviously we want to get to step 9, but that's a little ways down the path. Okay, Jen. So these are our two bills. Now put these numbers into your memory bank. I always like to transpose numbers, but I think I'm doing pretty well. So Senate Bill 2238 and House Resolution 4151. Okay, next. Jen's going to talk about advocacy, and we're going to kind of tag team on some of this. So Jen, it's your turn.
This is my favorite part. And I want to take a minute and reflect on how happy and honored I am that as I'm looking at the screens and flipping through the 70 some odd people that we have on this call, I recognize so many of your faces. And that's because you've taken the time to step up and advocate and support this. So on behalf of NOFAS, on behalf of myself and my family, I am so deeply humbled and grateful for your advocacy and your support. So thank you. It is an absolute joy and pleasure seeing all of you. So what's next? We have our two bills, Senate Bill 2238, House Resolution 4151. And we need to connect with, in every state, the 2 senators in your state, and then for you individually, you need to connect with the representative that covers you. So many of you already know this, but I'm going to give you the Cliff Notes version. In your state, you have 2 senators that cover the entire state. You need to connect with them. In every state, you have multiple representatives that cover separate areas, districts. The representative that covers the area where you live personally is also the one you need to connect with. We want to give special consideration to, on the Senate side, members of the Health Committee, and on the House side, members of the Energy and Commerce Health Subcommittee. And if you remember before in previous presentations, we've talked about how we were targeting key members. Those were those key members. Now we want to be targeting everybody, but we still want to be focusing and paying attention to those key members of the House and Senate, because once the bill gets heard in committee, they're going to be the ones that see it through. So really important. Our main goal right now, though, is co-sponsors, because the more co-sponsors you have on a bill, the quicker the process can go, and the more likely it is to get heard in committee, and the more likely it is to get signed into a bill. So the work we're doing on the ground right now is absolutely mission critical. It doesn't matter if your senator or your representative is on a key committee. As long as they're willing to co-sponsor, that helps move things forward, and we really, really need that.
Yeah, and I just want to say that I feel like we're in really good support right now, but the more when you talk about leadership, because we've met with the staff of Representative Anna Eshoo, who's the chair of the subcommittee of the Energy and Commerce in the House, and favorably. So that's very important. The chief author of the bill is Representative Betty McCollum, who's also in a leadership position, chair of the Budget Committee, or the not budget, the defense, and is very close to Anna Eshoo. So we have that in the Senate. Amy Klobuchar, who's a co-sponsor, is in a leadership position. She's assistant or chair of the steering committee, chair of rules. Patty Murray, who we've had a lot of conversations with staff, and also comments to her from other advocates. She's assistant Democratic leader and obviously the chair of the Health Committee. So I feel like we're very well positioned, but they can't do it all. They need the support beneath them. And we have had conversations with a lot of the staff in the committee, but we need them to sign on as the ones that we've had to sign on as co-sponsors. And we've had, and I don't know if this is on this slide, Jen, or the next. We've had, yeah. So we've had already, and if you've been on social media, and Jen has teased you about co-sponsor, we've had 2 co-sponsors in the House that have indicated, and we don't want to put their names until we get a release from them or they're public, and it'll go on. If you go to congress.gov, and you go to the bill, it'll list those. Usually 2. What happens when a member decides they want to introduce the bill, they will contact either them in the House. They would contact the Representative Betty McCollum's office. Patrick Mallet is the staffer, although he's taking a month off now to study for the bar. So there'll be if you go onto the website, it'll be Sophia Schiller, I think is the new person to deal with for the month of July. And then they're also listed on the website as to who the members contact. And then they are the ones that will let the House know or Senate know that they have these co-sponsors. So if we get information from the co-sponsors that, yes, you can release it, we'll do that. But right now we have two confirmed, and we'll hope that we're obviously hoping that that's going to gather a lot more steam. Yeah.
All right. So the main things we're doing now, we're gathering co-sponsors. That is our number one goal. If you're going to put energy into anything, that is it. Gathering organization signatures for a letter of support. That's another thing we can do. So if you're involved in a trade association or a union, or you attend a synagogue, mosque, church, any organization that would be willing to sign on to a letter of support, we have a spot there on the website where they can do that. They don't even have to write their own letter. We'll do it for them if they want to write their own letter. Hey, cool. But we've got that all set out and ready to go. As Susan mentioned, we're working on staff briefings, and we're working on publicizing this and really getting it out there. So if you have any questions at all about what you can be doing to help, this is where you'll notice on social media, on the website, my phone number and email address are plastered everywhere. So feel free to reach out if you have any questions on this. And really, like right now is kind of crunch time, because currently the Senate's on recess. But what that means is the senators are out and about in their communities and likely doing town halls. Some of your representatives are going to be doing that too. And so if you have an opportunity to attend a town hall with your senator or your representative while they're in your community during this July recess, it's a great thing to do, and to bring up and to bring up the bill while you're there, and ask them if they'd be willing to support it. So additionally, we've got a couple weeks in July where they're back in session, and then they go back on recess in August. So this is the time when they're in their home constituencies, when they're touching base with people. So it's a really, really good time to reach out before they come back in September and things start moving towards committee. So 3 steps, 3 things you need to do. It's laid out in bullet points on the website. You contact both your senators. So when you go onto the website, you'll see the FASD Respect Act right up top. If you're on a mobile device, you click on the menu, FASD Respect Act, and go in there. It'll give you instructions on how to contact both your senators. It'll give you their websites. You click on their websites, you click on contact. If you don't know what to say, we've got some verbiage in there for what you can say to them. Same thing with your representative. You can go on there, see who your representative is, click on their website, connect with them. We will tell them what to say, or we'll give you support with what to say on the website. And then last but not least, step 3 is collecting signatures from organizations. And that's a really easy form. You can email out a website address to them to fill out the form, and they're good to go. So how you access this, again, on the NOFAS policy page under FASD Respect, if you scroll down just a little bit on the page, you'll see these 3 buttons. You are doing individual advocacy, you click there. That'll take you to a map of the US, click on your state, and it'll give you all the specifics for your individual state. Now I will ask you, because I've been the one putting things up on the website, if you see an error, if you see an omission, if you see something that, oh, hey, maybe that could change a little bit, reach out and tell me. I want to know. These are things I can fix quickly. And if you have a question about it, likely somebody else does too. So let me know. There is a button for organizations there. That takes you to the organization page that where organizations can sign on to a letter of support. And then legislative staffers, if you have a staffer that's looking for information on the act, the bill language, the one-pager from the author's offices, any logistical information about the bill, it's right there. Additionally, on that page, we also have links to congress.gov so you can follow the path of the bill. You can sign up for updates from congress.gov too. So anytime something happens on the bill, you get a notification in your inbox. All right. Starting July 1st, we have, just to break it down for you and make it a little bit easier, or if you want to get more in depth into your advocacy, we have 90 days and 90 ways to advocate. So on the FASD Respect Act, if you look over on the sidebar, there's a 90 days, 90 ways. And this gives you a really small email every day for 90 days with a supported activity that you could be doing to push the bill forward. So you can start this at any point. You don't have to sign up before July 1st. You can opt out of it if it's too much email in your inbox, that's okay. This is just that daily reminder of, oh, hey, here's something I can do to help move this. So I'm going to be emailing out a link to the 90 days and 90 ways sign up to everyone after the presentation. So you'll have that in your inbox, but just so you know where it is. And I want to give a huge shout out to Julia Rivera, our first sign up for 90 days, 90 ways. I hadn't even announced it yet. And this is how with it our advocates are on it already, even though it hasn't been announced. So thank you, Julia. In progress, Susan Carlson came up with a brilliant idea of a youth advocacy toolkit for youth with FASD. We're looking at ways, I know with my own children, I want to find ways for them to promote self-advocacy, and this is a huge way to do it. So this is a work in progress. If you are interested at all in helping support that initiative, if you are a homeschooling parent, or if you are an advocate with experience or a professional and you want to help out with this, I would love your help and input. If you just have a quick idea that you want to give me, hey, that's cool too. I think these tools are more usable and of better quality if we work on them together. So I encourage you to reach out if you have any interest at all in participating in that initiative. And I hope to have that rolled out before our meeting next month, but worst case scenario, it'll be rolled out by our meeting next month. Another way you can get information aside from calling me, again, my number is 202-601-2530. I should have it memorized by now, but reach out to me if you need to. Is the FASD Respect Act Champions page on Facebook. I give a lot of real-time updates there. Sometimes I'll get a message, say, from a representative's office or an advocate in the field. And I'm looking at one advocate in particular from yesterday who says, hey, we got our representative on board. I can't necessarily say who the representative is, but I get so excited. I want to tell somebody. I'll go on that Facebook page and say, hey, we got somebody who signed on. It's a place to collaborate and share ideas, and specifically on the FASD Respect Act. So we've got about 150 members there now, but feel free to connect and join there. Other resources and support for advocacy. We do have the Policy Center website. If you have any suggestions or thoughts on that, feel free to reach out. We've got state leave behind documents that connect information specific to your state on FASD that you can use for your advocacy. We have templates for reaching out to your legislators, verbiage that you can use. If you get a meeting with your legislator, we will do a practice session, give you a call agenda. We've got some trainings we can do on that, give you all kinds of support. So I am here as your administrative assistant for advocacy. If you need something for support for your advocacy to get this bill passed, because it's not going to be me doing it. It's not going to be Tom doing it. It's not going to be Susan Carlson doing it. It's going to be all of us working together to get this done. And so you're on top, I'm down here to support you. So if you think of something you need, please reach out. I will coordinate the materials and be a point of contact. And then we have our policy team, which has some really great minds that know a lot about the political process on it. So if I don't know the answer, I can take the question to them and get some good informed answers back for you. So we do have that. So next, I want to talk about something that gives me goosebumps. This is something I met with Natalie Vachon from FASD Hope, giving a shout out there. Great podcast and fantastic advocate. And she mentioned to me that there was a woman by the name of Rebecca Tillow who had a dream of setting up a 5K, a virtual 5K nationwide to support individuals with FASD and make FASD more visible in our communities. And so I connected with Rebecca, and Natalie connected the two of us. And as we were having the conversation, I really stuck my foot in my mouth because I said, you know, I would really love to have someone with FASD involved in creating this race, and someone with FASD being part of the committee on this race, because I think it's important that we have people with FASD informing the work that we do. And Rebecca mentioned, well, just so happens I do have FASD. And so Rebecca is our race chair. She is our race coach. She has a fantastic site on Facebook, Run Fast, that she's giving coaching tips and support for individuals wanting to do the 5K. The 5K is in September. You can do it from anywhere. It is a walk, roll, run, meaning you do it at your own pace. I can tell you at this point in my life, I don't know that I could run a 5K, but I'm going to walk it, probably pretty slowly. So really excited about that. You can register for Run FASD. And again, it begins September 9th. You can register for it online on the NOFAS page. Just scroll halfway down the page and you'll see the great big Run FASD logo. And the logo really is very intentional too. When I say Rebecca has really informed what we've done with this, you know, we were talking about songs that she likes to run to, and she was collaborating with her son on songs that made her feel empowered to run. And one of them was Imagine by the Beatles. And that's why we have the cloud in the background. We have the sun that is a direct copy of the Carly logo, sun from NOFAS, that is incorporating the work of someone with an FASD, but it's bringing light to FASD. The run, we've had that in movement letters because we are moving forward with FASD. There's the shadow behind the FASD letters because there are so many layers to FASD and because there's so many dimensions to FASD. So there's a lot of thought and intention that's gone into this. So Rebecca, I don't know if you want to say a few words about the race or your thoughts on what we should be doing next with this.
Sure. Hey guys, my name is Rebecca Tillow, and I owe it all to Jen. Did the whole design. She's incredible. I don't know if I've ever met somebody like her. She does everything, and I don't know when she sleeps, but so she has made this all possible. But I am very excited. It's going to be amazing. The thing is, we're trying to make strides, just make strides to make people aware of what FASD is. And I know in my state, New York, and in Albany, where I live, not much is known about it. So I am hoping to break through barriers and make everyone and anyone aware of it. Doctors, educators, social workers, everyone and anyone. And And we're also trying to making strides to stop the stigma of FASDs, that they aren't a visible disability, but we are, they don't define us. And also to stop the stigma on moms who do drink when they are pregnant. I have not met a mom who drank to harm their child. Alcoholism is a disease and it's addiction. It's an addiction. So we hope to make strides to break the stigma on those moms that drink. It's not a choice they made willingly. So, but I'm super excited. September is National FASD month. So it's perfect to have the virtual race be that September 9th through the 15th. I have a FASD Run Fast live, what's it called? Facebook site. And yeah, if you can run it, you can walk it, you can roll it, you can bike it if you want, whatever, just to raise awareness. That's really what this is about, to put FASD on the map. And that's it. So I'm super excited.
Thank you so much, Rebecca. Like we couldn't have done this without you. And again, she's very humble. Anything that I've done has really been taking her ideas and her thoughts and bringing them to life. And so I have so much gratitude for you and the work you're doing. So your race registration, one of the questions in the chat was, can we get t-shirts? Well, the race registration does come with a t-shirt, a race bib, and a medal, because we love bling.
That's right.
So more information will come out on that. We have a short video that explains a little bit more about Run Fast, and we'll get that out to you in an email today too.
Perfect.
Any questions? I want to open things up to questions on the FASD Respect Act, Run Fast, anything we've talked about today. We've got about 20 minutes, and if I can let you go early, hey, awesome. Everybody could use a few more minutes in their day, but really wanted to open the floor up and see where you're at and see where your thoughts are.
So hi, Jen, this is Lee.
Hi, Lee.
Hi, I've been in and out about 4 times. My internet, it's raining out here in the middle of Missouri, and so my internet goes in and out multiple times when it rains. All I want to say is this is fabulous work. You are awesome. Susan has done, the two of you have done amazing work. I am really quite blown away. So particularly this process that you've outlined and, given us very clear ideas and very clear understanding of where to go and who to contact and timeline. And man, you've just, laid out the schedule for us. So just want to say this is absolutely fabulous.
Thank you. Coming from you, that is high praise, because I have so much respect for you, Lee.
Oh,
and I just want to say, because of the recesses, that after the July recess, there's a 2-week window of opportunity for a lot of advocacy before they come back and take another. Recesses can change, but I would just encourage everybody that hasn't done it, the advocacy that from after the July recess, you've got 2 weeks to really do some heavy advocacy with your members and staff. So start working on that. And then the August recess will be a great opportunity for you all to go to their town hall meetings. I don't know if you recall, back in 2016, there was a group called Indivisible, and that was started to address the Affordable Care Act, and they had a lot of people coming to the town hall meetings. So if we could do the same thing in August, go to the town hall meetings and have your signs with FASD Respect Act, that would be fabulous.
I think maybe we could even make up some templates that you can print at home.
Yeah.
So gave me an idea for the website. Thank you.
You're welcome.
There was a question in the chat, Susan, and I don't know the exact dates on this. Do you happen to know the exact dates for the August recess and the July recess?
Well, let's see, I've got my handy dandy little congressional quarterly that gives, and maybe if any other policy team knows this right off the top of their head. This is a great resource, by the way. It's every information you want to know about Congress, committees and everything, but they have their schedule in here. And I think it's, so if you want to go ahead with another question, I will look it up.
Then the August recess starts on
I knew.
of August. And it
Sorry,
runs,
Kate, you cut out. What date?
it begins on August 2 and it runs variously into the beginning of September. Well, even to some extent, halfway into September. While I have the floor, I just want to urge people to start immediately, if they haven't already, emailing their Congress people and their senators to co-sponsor, and do that now. Because even though they're in recess, sometimes the staff is working during the recess, and in any case, you get your pitch in now. It takes a while for them offices, the staff to discuss it with the member and get back to you or to the sponsors of the bill for a sign-on. But the more we work now, the better. And I urge you also to consider trying to set up a meeting with your congressperson or senator during one of these recesses. Town halls, if they hold them, that's a great idea. I echo Susan's recommendation, but I also urge you to set up a meeting in person if they're taking them, or to call the office and ask to speak to the health staffer to follow up an email, because the more you press like that and press the flesh, the farther we're going to get. Thank you.
Those are great suggestions. Thank you. Oops, I accidentally, I'm just going to stop the share there. So other questions at this point? Wow, everybody has their marching orders. They're ready to go. This is great. I love it. I love it. So, definitely coordinating with other disability rights groups is a great idea too, if you're able to do that. Definitely, they would be, signing on to our letter of support would be a good way to do that. I noticed somebody with the name Robert Land on their screen asked a question.
Hi, Jen. Hey, I talked with you. Actually, I'm not Robert. That's my husband. I'm Mary Bagatellos.
Oh,
and
yes.
I'm the person who talked to you before you talked to Kathy Page for Silicon Valley.
Yes.
So I just wanted to let you know we're all really excited and very, very supportive, and can't wait to do what we can do.
I am so glad you're here. And yes, California has been fantastic.
Yeah.
In terms of their advocacy. And if you live in the state of California, additionally, they have a great thing that they're working on right now, FASD Now. So connect with the advocacy groups. If you're not affiliated with one already and you live in the state of California, they're working on some fantastic legislative initiatives on a state level there.
Yeah.
Oh, thank you for being here. Dr.
And
Christina
I just wanted
Ubben.
to say, with regard to that, I have actually started the process of developing a model bill that other states could use based on the language we have in the FASD Respect Act. So maybe that'll be my teaser for next policy, to share that with you. Obviously, it would change depending on the language of the bill, but it could be very simple too.
Awesome.
Oh, thank you, Jen. Christina Ubben here, and I'm in California, but I also live in Colorado, so I would love to connect. I already know a lot of the California people, but I'd love to also connect with some more Colorado people. In addition to that, I just wanted to say that in public health policy, Denise Payan, I can put a citation here, but she termed the coin local policy push. And it's just a term that if you're not already familiar with it, it's just a way that, public health researchers have found that real change is not like a couple people with the strings manipulating the puppets. It's really when all the local kind of voices push at the same time in the same direction, that's where the real magic happens. So she's just done a bunch of documentation in her research showing this in different contexts around sugar and all the, everything. So I'll share her citation in the chat. I just wanted to preface that context for sharing it here, because I think it's local policy push is exactly what Jen and everyone is trying to do here. Thank you.
Absolutely.
Thank you. Beth, you had a question?
Yes, I love what she just said about local policy push. I'm all there, and that's what we're trying to do with North Carolina, across the state, across organizations. So if you were to give, you said consistent communications, that's how we're going to really get this heard and get the right messages heard. Can you give me your elevator speech or your 3 things that you say?
Susan, you want to take that one, or you want me to take that one?
Well, why don't you start it and I'll chime in. I'll see what your elevator speech is. I know what mine.
Yeah. Well, I think the consistent message is that FASD impacts 1 in 20 and or up to 1 in 20 in the US, and that by supporting individuals with FASD, we are making a difference in multiple systems of care throughout the US. And so the FASD Respect Act is a connecting cord that utilizes existing infrastructure to better support outcomes for individuals who are typically ignored or not supported in a way that's appropriate for their disability. That's what I would say. How about you, Susan?
I love that. I love the connecting cord image.
Yeah. Jen and I have worked well together because she takes ideas, and I mean, that's how the house came. But if you go to the summary, there's the need for action. So that's basically a lot what Jen said more articulately, I think, for an elevator. But it does get to, this is, harm to children, 1 in 20, and that are not being currently being supported by our existing systems of care. And those that are parents and families want to be supported by our existing systems of care.
And I would just add, since you're from North Carolina, that the pitch you really need to make is to your senior senator, Richard Burr, because he is the ranking member of the Senate Health Committee. And if he goes along with the bill, we have a much better chance of getting action on it, because I think with Jen and her team in Washington State, we've made a lot of headway with the chair, Patty Murray, but we really need to get Richard Burr on board.
Absolutely agree. And we have our ways that are planned for big, local push so that he has to hear it.
Excellent. Great.
And we'll work too on supporting that push with making sure that we have some really high profile subject matter experts to support you on that call. Definitely Burr is top of mind.
And we had another meeting and we had Phil May, who was terrific. Very terrific in that meeting. And it got to the issue, well, the 1 in 20.
And another thing that you can be doing, and this is silly, but it actually does carry some weight, is whenever you're posting something on social media, it doesn't matter what it's about, use the hashtag FASDRespect, because we can then tie that back to the senators and the representatives and their media liaisons and just start building a little bit of a buzz. So hashtag FASD Respect is a great way to get attention because it covers a multitude of things. It covers the act, but it also covers the way we need to be, or the way we want to be viewing FASD in our community. People with FASD deserve respect. So.
Jen and Susan, I'm wondering, you talked about high profile people being able to join those calls. Would it be possible for people in those high profile areas to record their message so that we could have a link to that recording to give to our senators, so that we're not, I know face-to-face would be great, but so that we're not overburdening those high profile people to have multiple meetings, but we could just give a link to that to the senators in our state, and then they could go back and listen to that, or their aide could go back and listen to that.
Yeah, I think that's a great idea.
I love that idea.
Yeah.
You would laugh if you saw my notepad after one of these meetings, because the amount of notes I take for things to do and the ideas that I get from all of these fantastic advocates is just incredible.
Hey, Jen, I had a question for you.
Yeah.
So say, for instance, our dear friend, Senator Burr, when we're doing our social media post, can we hashtag Senator Burr? Because I know they have social media and they're following it.
Yep.
So if is that rude, or is that appropriate, or to keep bringing it up to his team that we're wanting him to pay attention to the FASD Respect Act and
I
tagging?
think if it's one person doing it over and over and over, it's rude. If it's multiple people doing it over and over and over, it's groundswell. It's groundswell and grassroots.
Okay, so there's a lot of people from North Carolina on, so let's start tagging him, is what I'm hearing.
Absolutely. There are, and yeah, that's exactly it. Start tagging him. Twitter seems to be the Politico. Facebook is great. Instagram is pretty. Twitter is work. So if you're on Twitter, that's the best place to do it.
Okay.
Well, and then another suggestion, if they do co-sponsor, then you can, they all have their Twitter accounts. So you can thank them. I've done that with our co-sponsors already, thanking them in posts. And anytime you see a post, just acknowledge that. It can be a powerful tool.
Well, the other thing around that too, and why I mentioned if you're doing it in social media that's not your typical social media, is we as FASD advocates do this thing where we communicate within our circle, right? So we send things around from FASD advocate to FASD advocate to FASD advocate. And if you're in that circle, you hear about it. But what we want to do is we want to make it into a line instead, so that we're sending this information out beyond the FASD circle. So again, great getting the information out there on FASD groups and things like that. Totally cool. We need that because we need the grassroots support, but we also want to open this up beyond, the core people who know about FASD and get it out there. So that's part of why I suggested that.
So Jen, there's a comment, will there be a standing meeting for these organizing efforts in the next 90 days? Well, we have this meeting every 30 days. So we'll have another webinar, July, what's the date?
July 28th, Wednesday, July 28th at 2 p.m. I've kind of toyed with the idea of maybe having a drop-in where we don't have a formal presentation, but you can ask questions if you want to. So let me know in the chat if you think that's a good idea. And let me know if you want to, if that would be worth doing. And Hope, I believe you had a comment.
Sure. I'd just like to follow up with what you were sharing about everyone speaking to each other. If you could just, if everyone could read the details of the bill, there's a variety of topics that were not in previous legislation that really relates beyond just FASD and FASD prevention. We added the adult lifelong kind of issues, that's critical. But importantly, it's FASD is the kind of centers a lot of intersectional issues. The incorporation of social determinants of health, it's great to hear some public health folks on the line. Social determinants of health is kind of a public health jargon, but we explicitly wrote in there housing and food system issues and, you know, just basic kinds of issues that oftentimes people don't think around the issues around prenatal alcohol exposure, how that impacts, but kind of thinking out of the box, peer mentoring, of just a variety of issues. So look in there for details. There's a lot of ways to, and also importantly, like I know our other senator who is not signed on yet, Senator Dan Sullivan, you know, he's particularly interested in opioids. He's really been a champion of opioids. And this bill looks at prenatal alcohol exposure and other substance exposure, which is a huge issue. So, and issues around structural racism, historical and cultural trauma, these things are critical and they're also very relevant. People are thinking now around health equity, disparities issues. You know, these things haven't been embedded in the legislation before. Our representatives are really keen. They know that these are current issues. So consider what your folks are thinking about, and 10 to 1, there's something in the bill that relates to that. So that's exciting. Just one other piece is that I really appreciate the fact sheets, the state fact sheets that NOFAS has put together. And I know that there were some footnotes in each of the fact sheets, but I'm wondering maybe Jen, I could kind of follow up with you because I know that we're going to be asked where those little factoids are coming from. And so I would believe that other folks around the country would be as well. And some of them are very general, but I know the folks locally want specific. So I'd appreciate, it would be great to know because there are detailed numbers, detailed relationship to what's happening in our state. And I wasn't familiar with some of those facts. So I look forward to following up with you.
Absolutely. And Hope, I want to give you a big thank you too, and the rest of the team in Alaska who have been so critically important in their support of the bill and in helping inform Senator Murkowski and her staff on the issues around FASD. And really, we couldn't have made this bill be what it is and have this push be what it is without Hope and the great folks working on behalf of FASD in Alaska. So thank you for that. Beth, you had another question. I think you mentioned in the chat your hand raise wasn't working.
You may be talking to me, Mary.
Mary.
That's okay.
Oh, sorry,
That's
Mary.
okay. That's okay. So my question was when you were talking about Richard Burr and about, you know, various people tagging him on a Twitter is groundswell. How do they respond if you're, you know, basically they're a linchpin, but you're out of their state? How do they respond to people who are not in their state?
Well, in the case of Twitter, they don't necessarily know.
Okay, so, all right.
that's a really good point. Thank you for bringing that up.
Okay.
And I also want to thank Hope and the Alaska Advocates for all the work they did in really improving the bill. I do think adding the other prenatal substance exposure will be very helpful in getting authors that have been active in the opioid legislation, because this is, when I said it earlier, it's a systemic look at prenatal substance exposure to include alcohol, which has generally been left out of the picture. And so states are going to look at prenatal substance exposure in a systemic way. And when you're screening for one, you're screening for all, because we know 40% of women who do drink also use other substances. So that, I think, was we started putting that in the bill, but Alaska put it in lots of other places. So I think that will add a lot of authors. And as you do your research on your congressman, you can go and see if they've authored opioid legislation. So that would be a good tie-in. But thanks. And I also have to thank Minnesota too, because we have 2 Minnesota authors, and the Minnesota Proof Alliance folks have been very helpful also in helping us with the bill.
So we are at the top of the hour. I am happy to stay on and answer additional questions, but I think I want to let people go if that is, you've got other things on your schedule and other things on your agenda. I am hoping to have an email out today that will have a link to the recording of this presentation, a link to Run Fast, and a link to 90 Days, 90 Ways, the sign up sheet for that. So thank you all so very much for your advocacy. Thank you for your support, and absolutely, please reach out if you have any questions, thoughts, concerns. I want to hear from you and I want to help.
Jen?
Yeah.
This is Dory, and I'm down in Texas.
Hi, Dory.
I don't know if it says Robert, that's my husband's name, but I'm not sure how that got on there, but anyway. And I had asked the question about the liquor lobby also, and had answered them. We did some research, actually Texas A&M University, they did some research both in the Ukraine and then did it here in Texas. And what we saw was there was a prevalence in a certain area of Texas. Thank goodness it wasn't Houston where we are, but it was like 17.7% in the entire community there. Where they had detected alcohol when the baby was born, and it stays in the baby's blood for like 3 weeks after the baby's born. That's why I was also asking about the blood marker question, because they did that research back in 2017. They gave it to the Texas legislature. Instead of saying, look, we really need to be testing these children, they came up with a very strange bill where they were focusing it on foster care children. But what they were saying was, if the foster care agency knows that the child is affected by FASD or FAS, then they can test the child and do things. That's too late. These children can be teenagers by then in foster care. That's why I was hoping, maybe we could start advocating at the very beginning, because they need, the health care, they need mental health care, they need the trauma issues, they need all of this taken care of, and they need it throughout their lifetimes. We talk about, there was a big push on stopping homelessness, and I know Hope talked about this, and thank you so much for talking about that. But we know that there's a group of homeless folks who it's very, very hard to work with, and they have mental illness. And we know from Dr. Streisgoose research that there's you go through this whole spectrum of lifetime experiences. And we've got to address it from the beginning to the end. And there's also one other thing I wanted to share with you, and I'm so sorry that we lost Justice Ginsburg on the Supreme Court, because there was a lawsuit out of the state of Texas. This child had his mom had drank when she was carrying him, and then he was born, and she treated him terribly throughout his life, his growing up years. She was an alcoholic. She was also a drug addict. He, of course, got into all kinds of trouble. He did kill some people in Texas. So what did they do? They sentenced him to the death sentence. Okay, they said, we're going to kill him. At the hearing, he asked for a second hearing on appeal, and he said, well, I'd like to bring in the fact that I had FASD and all of this whole situation and how I was raised and what went on. Only Justice Ginsburg and Justice Sonia Sotomayor went back and said, well, gosh, if we're going to condemn this person to death, then the least we can do is look at what happened to him as a child. And the rest of the Supreme Court said, no, we will not look at that. We will simply affirm the death penalty. Through no fault of his own, the United States of America, the state of Texas, said it's okay to kill him. Now, there's supposed to be an equivalency of FASD to mental retardation, and we do not give the death penalty to people who are mentally retarded. And that's where these two justices were trying to go. That's why, to me, I would really love to see this legislation say, we've got to start at the beginning. Just like we have blood tests for other things that are health issues and that are very important, we need to look at that. But I do want you to know there, and this was not the first case where somebody was given the death penalty. There have been several cases in Texas. I don't know about the other states, but they knew that they had FASD.
Oh,
So
Dory.
it's something to think about.
Yeah, and that is something that the NOFAS Justice Task Force is looking at, specifically to Texas. I know they are planning on doing a one-day training specific to FASD and looking at FASD in the justice system in Lubbock, Texas in May. So that is coming up. And that is part of why the bill is so holistic, looking at all the different systems of care, because you can't really deal with one part of a person's life without dealing with another part of a person's life. You know, it all runs together. So the language of the bill, and I would encourage you to go through, like Hope said, and read through the language of the bill and see exactly what this bill does cover. So Madonna, you had your hand up.
I was wondering if there was a one-pager, and I don't know if I'm correct, but the one on Senator Murkowski's site was about the 2019 version, but I might not be right.
It should be updated now. I know it was incorrectly put up as the 2019 version. We do have the current version. If you go on the NOFAS policy site, and remember those three buttons I showed you for individuals, for organizations, and for legislative staffers. For legislative staffers, it does have, if you click on that, it does have the current one page also listed there. Also, if you have not signed up to receive policy updates and you got on this call from a different mechanism from Facebook or whatever, I would strongly suggest that you go onto the policy website and sign up to receive updates, because we're going to be sending them out more often now, and that's a really great way for us to communicate action alerts and things like that with you, and that way also you're informed about the next meeting. So Tom, did you have anything to say, or Susan, before we kind of close out?
I just want to again echo all the comments that are in that chat box about the excitement and the positive work that's being done. And thank you all for being in charge of this, getting it going and representing this issue so well. We're so thankful to have you in place to be able to see the progress that's going.
Yeah, and I just want to thank all that have done the advocating thus far, and thank all that are going to bring this across the finish line. I've never been as optimistic about this legislation.
And I would join Susan and everyone's enthusiasm for that, and thank the NOFAS team, Susan, Jen, Susan, also Kate's still on the NOFAS chair, and then Mike Anderson and Catherine Shea, other members of our team. And let me also, while I'm doing it, I want to thank you and Judge Jeffrey and Terry and Marilyn in Alaska and all the folks who've done such great work, and Rebecca for the Run FASD. It's going to be very exciting. So let's all not lose focus on that one most important task. We, as Jen said, we each have 2 senators and a representative. Those are the people that we need to communicate with. And if you're not sure if they've already been communicated with by an FASD advocate, check with Jen. If they maybe are in the middle of considering signing on to the bill, check with Jen and make sure that we have 1 or more people going out after every single member of the Senate and the House, and we can make sure we get an ask and all the appropriate information to the appropriate staff member and get those requests in and get some answers that we can put on the board with co-sponsors that make a decision for both the House and the Senate an easy one, and that is there's so much support for the FASD bill that it can do nothing but pass. So thank you, everyone, to all the advocates too.